Hi, welcome to Cycle 360. I'm Joel Khoury, and it's my pleasure to be here with Dr. Andy Hoofnagel, Associate Professor at the University of Washington in the Department of Laboratory Medicine and Head of the Division of Chemistry at the University of Washington. In addition, he's also the Director of the Clinical Mass Spectrometry Lab and Director of the Reference Laboratory, in addition to many other roles that Andy plays at the University of Washington. So Andy, you're also Associate Editor at the Journal of Clinical Chemistry. You're the founding member at MSACL. You're involved in many organizations, including AACC. How do you get involved with all these organizations, and how do you keep track of everything you're doing?
Well, Joe, first, thank you for the invitation and being here. And just my being here is emblematic of how you get involved in all the different things. You basically are given opportunities and you say yes. So if you think about each of the things that I've become involved with, you mentioned being one of the founding members of MSACL. I remember Dave Harold and I sitting in a bar playing pinball and drinking beers and talking about how important mass spec is in the care of patients. And he said, I've got this crazy idea. We were following up on one of the ASMS meetings, the Asilomar meeting, where it was the first clinical mass spec meeting that ever happened. And he said, I really want to do this, but I need somebody to give me a hand. Would you be interested? And it was a quick answer. The answer was yes. And I was still a junior faculty member at the time. I had just become a faculty member in 2008. And so he was excited. His excitement was contagious, and it was easy to say yes. And so that's how I got involved with MSACL. With AACC, being a clinical chemist, it was pretty natural to attend the meetings. There were mass spec sessions at each of the annual meetings. There were, other general mass spec and other general clinical chemistry sessions that were interesting, and so just getting involved in the people that went to AACC allowed me to become involved in AACC.
And it's important to note you're also on the AMOC committee last year, so that was also a new level of involvement for you there as well.
Yeah, I had been the chair of or I can't remember what it was, president or chair of the proteomics division, and so I played and treasurer and played some leadership roles in the division level, which I think was very rewarding because it was very subject matter specific. It's hard sometimes to quantify how the divisions are making an impact in people's careers and in their lives. But at least you're hanging out with people that shared a common interest and things like that. And they did things like offer poster awards and other acknowledgments of people's hard work and effort. And so it was good to be in that group, see colleagues doing good work and all that kind of stuff. And so my involvement in AACC led Bill Clark to say, hey, Andy, do you want to be a vice chair? So it was really fun, he and Gwen and I trying to think about where to take the science part of the meeting and then the whole AMOC coming together along with Gail Mutnick and just having an amazing group think and coming up with what turned out to be a really fun Monday of science for us. I'm glad that we did it. I think it turned out really well, and that's even an innovation around the science and the meeting itself. It was a fun thing to do. So, but again, it was saying yes, if you know what I mean.
And on top of that, you're also actively involved in writing grants, getting research support, getting industry funded to do the work that you do in clinical proteomics, which we're going to get into. But so my question there is, how do you actively pursue, this is typically not a traditional way I think clinical chemists do, which is writing grants, going after patents, which you've already also done. So how do you what advice would you give to people looking to do that and kick off their research career by writing grants and getting patents?
Well, I'm going to skip the patent part. I think it was a fun thing to do for me to write a patent and see what it was all about. But I think that in many cases, writing patents is a distraction, and I think that if you're out to make money, you should be doing that in the private sector. If you're going to be in academics, writing patents, for me, I did it as defensively. I wanted to be able to practice the art of measuring thyroglobulin by mass spectrometry. And so, setting the patent aside, the grant stuff is really fun, and it's one of my favorite things to do, to immerse yourself in the literature and think about what are the gaps and how do you convince somebody else to pay you to do the things that you love. That's what a grant is, really. And so how did I get involved writing grants? The residency program is 3 years long, and you have an intense period where you're learning for a clinical pathology residency is 3 years long. So you have that time where you're just absorbing all of that knowledge about microbiology and blood banking and clinical chemistry and others, and you come up to speed on being able to be a clinical pathologist, and there's time left over. And with the time left over, you have a chance to be the acting director of one of the clinical labs. Oh, and by the way, you have a few hours every day that you can do some science. And so you get to be in a lab, you get to hold a pipetter, you get to do all those things that are the basic science side of things. You can even take care of mice if you wanted to, and inject them or do tail veins. You can do all sorts of fun things, surgeries, during that 3 years of the residency program. And what's amazing was during the third year, I got to start writing grants. I actually got to put pen on paper to ask for the money to pay for the things that I really love to do. And it was that opportunity that allowed me to, at the end of residency, to have grant funding as I started my assistant professorship.
And unfortunately, PhDs don't get that opportunity.
Well, but see, they do, right?
Yeah.
So COMAC programs, by and large, are limited to 2 years. But certainly, WashU has a program that offers a third year, and the University of Washington has the flexibility to offer another year if there's somebody who's excited to do that. It's not your average applicant, right? Most of the applicants to COMAC programs are looking for not. I don't want to write a grant. I actually want to have a different career path. But there is really an amazing synergy between having the access to the clinical specimens, all that clinical data, and outcomes. I mean, it's really an amazing place to do science. And so I think even PhD clinical chemists could take advantage of that extra year to do the basic science or whatever other kind of science they want to do. Clinical research is fun too, and get their grant funding at least jump-started. So that was the first grants that I got. I actually wrote for during the third year of my residency, but the first grants that I got during the first 5 years of my faculty I couldn't write them if I didn't have senior faculty who protected my time. So as a physician scientist, being brought on both to write grants and take care of part of the clinical lab, they said, your clinical role is going to be, your offer letter said 30% clinical time. That's how much time you're going to spend, and the rest needs to be devoted to research. Which was amazing, right? So I had Pete Rainey, an incredible mentor, very generous with his time and effort and knowledge. Mark Wenner, again, another amazing mentor. Jim Fine. People protected my time, and they said, you need to write the grants. You want to do that, you need to do that, go for it. And if it doesn't work, we'll figure something else out, but give it a shot. And other colleagues who are physician scientists in the department have had the same opportunity to have the free time away from clinical work for the first part of their career to write their grants and give it a shot, because it doesn't work for everybody. But if you're never given the opportunity to write the grants during fellowship and residency, and you're not protected during the first part of your career, you may not be able to write a grant after. It's very unusual for someone who graduates from a COMAC program, starts running a clinical lab, to write a grant and get it funded.
And
very
I can tell
unusual.
you, I can barely find the time to do any of that. So
yeah, because you're still getting thrown information as you get started. So it's
better start early than
better to start early
during your training.
Later.
So then, what got you specifically interested in what has become the hallmark, I guess, of your research and focus now is clinical proteomics, especially by mass spectrometry?
Speaking of mentors, Mark Wenner, who's an amazing individual and also a tangential thinker, walked up to me one day in the office and said, do you think that we could measure thyroglobulin by mass spec? And it was a game changer for me. It changed my career because he was asking a very relevant question. We had this assay, and many immunoassays are interfered with. Specifically in thyroglobulin, we know that autoantibodies interfere. And he had heard me talk casually about digesting things with trypsin. Hey, could we digest away all this stuff? Like, could we do this? And I said, let's find out. And so I was given the time. I had the resources to ask the question, could you find thyroglobulin by mass spectrometry? And so we used an antibody to a peptide, pulled it out of the tryptic digest, and were able to see it. And we published that paper back in 2008, where it was the first proof of principle study that you could use mass spec to find a tumor marker. So I got excited because we could this is Wayne Chandler, another mentor of mine back in the day, said what's really fun is just to take lab medicine and apply it to basic science. And he was right. And so we had people doing proteomics and trying to say that they're quantifying proteins, we were able to take the lab medicine side of things and say, oh yeah, you really can do it. You have to do it a little differently than the rest of the field is doing it, but if you do it this way, you can actually get meaningful data. And by doing it this way, I'm talking about calibration, using internal standards properly, writing standard operating procedures so that you can get precise and accurate data over time, which is what we need in the clinical laboratory.
Yeah, I was gonna say.
So my passion for that started with Mark's casual comment and question, proving that it could be done, and then realizing we should be doing this for all proteins.
And now you've moved on, obviously IGF-1 and talking about ACTH as potentially the next target. So where do you see the future of this going? Are we going to be able to do all proteins that we're currently doing by immunoassays by mass spec?
The simple answer is we will be able to do it. The next question will be, do we want to do it, right? So troponin, we know we want a rapid turnaround time. Are there false positives and false negatives? Yes, in every assay. Some are worse than others, as we know. But you need the turnaround time. So until we have the technological solutions, or the technical solutions, whichever I should say, such that we can get a turnaround time for troponin that's less than an hour, we can't rely on mass spec. But once we can do that, I think we're in. I think we're golden. And I think we'll want to, because the accuracy is just amazing. You get rid of those sample-specific interferences that you have no idea are happening in an immunoassay. In the mass spectrometer, you'll at least know that something is going on that's giving you a bad result. So can we? The answer is yes. Will we? I don't know. It's going to take some time. But in terms of what is a reference method procedure, it's not going to be an immunoassay. In 5 years, we're going to look at an immunoassay and be like, well, that's fine. What does mass spec say? And I think that's going to happen for more and more tumor markers and more novel biomarkers where immunoassays, it just takes too much time, effort, and energy to make them. We're going to use them. We're going to use mass spectrometer.
And so finally, Andy, any advice that you'd like to give to our cycle members?
Well, yeah. So the young cycle members, I used to be one. I'm too old now. I think that, I think that as we get older and we are trying to look for community, we have to think about what we do with our time. We were talking last night over beers about, when do you say no? When do you finally say, that's something I can't do? Right? We're talking about saying yes and getting involved and finding all these fun opportunities like AMOC and being on the clinical chemistry editorial board and stuff like that. You say yes, but there has to be a time when you say no, and you have to be selective. So for me, as I've gotten older, I've started to realize that there are organizations who cater to the needs of their members extremely well. And I'll use MSACL as one of the first examples. A small group really focused on clinical mass spectrometry and improving the care of patients. It was awesome to be a part. I've stepped back from the scientific committee so that younger people, like cycle members, can start to plan individual sessions and be on the scientific board and all that kind of stuff, so that they can make the contribution to the next generation of clinical mass spectrometrists. So now Russ Grant and I sit on the awards committee and try to find out who's done the most for our profession over time, allowing a whole new generation to become involved in MSACL. So in that respect, I think finding the organization that really captures what you're most excited about is fun. ACLIPS is another small organization, really devoted to all of laboratory medicine, but people who are interested, a lot of academics go there. So if you're interested in an academic career in pathology lab medicine, clinical pathology lab medicine, ACLIPS is an amazing opportunity to meet the senior people who are going to be hiring. It's amazing.
That's true.
But it's also great. AACC is a great opportunity for people interested in
science.
Yeah, the brown bag is a great opportunity to talk about something that you're really passionate about with a smaller group of people. To give a symposium is a great career. It's intimidating as you're a young clinical chemist to stand up in front of an audience and talk to people, a room full of people, and you're wondering, do I know more than them or not? The nice thing about AACC and being a clinical chemist there is that you're really speaking to an audience who needs to learn from you. They're mostly medical technologists or medical laboratory scientists who want to learn. They're there and they don't know as much as you. So it's a great opportunity to stand up and talk to people and give them information that they wouldn't get in another way. Become involved, but start saying no and tailoring how you spend your time. If you want to do grants, you've got to start early, because don't expect to pick it up later. And then find a home, find a group of people
Small
that you're
people, yeah.
excited to hang out with and call your friends as well as your colleagues.
Thank you very much, Andy. Appreciate the time, and thank you everybody for watching.
Thank you.